All India Radio presents Morning News. Good morning, I'm Sunil Verma and with me is Abhishek Mukhopadhyay. The headlines. India performs much better than world nations in terms of infections and mortality rate due to COVID-19. Health Ministry reiterates its appeal to people to maintain hand hygiene and physical distancing to contain the spread of infection. Hotel quarantine requirement for Indians returning from abroad reduced to 7 days from 14 days. Uttar Pradesh government completes skill mapping of 15 lakh migrant workers. Migrant Commission to ensure employment to them. Second Squadron of indigenously developed light combat aircraft Tejas operationalizes at Sulur base in Tamil Nadu today. Incessant rain disrupts life in several northeastern states. India performs much better as compared to global average in terms of number of infections and mortality per lakh population due to COVID-19. Briefing media in New Delhi yesterday, Health Ministry officials said due to the lockdown and containment measures taken by the government, 10.7 cases per lakh population have been reported in India as compared to 69.9 COVID-19 cases per lakh population for the world as a whole. The officials said 4.5 deaths per lakh population have been reported for the world, while India has reported about 0.3 deaths per lakh population, which is amongst the lowest in the world. The official added the COVID-19 mortality rate in India is among the lowest in the world at 2.87%. Health Ministry also says that the recovery rate of patients from COVID-19 infection has now gone up to 41.61%, which was 7.1% in March this year.
अब देश में 60,490 पीपल रिकवर हो गए हैं और उसके साथ ही जो हमारा रिकवरी रेट 7.1% करीब मार्च में था वह बढ़ते बढ़ते 11.42%, जबकि हमने सेकेंड लॉकडाउन शुरू किया। थर्ड लॉकडाउन शुरू करने के समय पर वह बढ़कर 26.59% हुआ और हम देख रहे हैं कि फील्ड में एफर्ट्स करने की वजह से वह लॉकडाउन के इस प्रेजेंट टाइम में बढ़कर 41.61% हो चुका है।
The Health Ministry official also appealed to people to maintain hand hygiene and social distancing and wear masks while stepping out. He said there is a need to focus on prevention and containment measures to contain spread of COVID-19 infection. The official added about 50% of deaths reported among elderly people, while 73% reported in the patients with comorbidity.
करीब 50% डेथ केसेस एल्डरली पॉपुलेशन में रिपोर्ट हुए हैं और साथ ही करीब 73% केसेस जो डेथ के हैं वह पीपल विद कोमॉर्बिडिटीज में रिपोर्ट हुए हैं। तो हम प्रिवेंटिव एस्पेक्ट्स को लेते हुए अपने घर में जो एल्डरली हैं, अपने घर में जो वल्नरेबल पॉपुलेशन है, उन सबको बचाने के लिए सारे प्रिवेंटिव स्टेप्स लें। अगर हमारे को कोई भी ऐसा केस दिखता है कि जिसमें कोई हमारे को सिम्टम्स हैं तो हम गवर्नमेंट द्वारा ऑर्गेनाइज की फैसिलिटीज को एक्सेस करें।
ICMR Director General said that currently over 1 lakh samples for COVID-19 are being tested in a day. He said the country has now 612 labs, out of which 430 are government labs and 182 are private labs. On use of hydroxychloroquine HCQ drug, the ICMR DG said that HCQ has been widely used against malaria, and considering its antiviral properties, in vitro study data and availability and safety, ICMR had recommended it as preventive treatment on trial basis under supervision. The ICMR DG added no major side effects of HCQ have been found in studies in India except nausea and vomiting, and its use should be continued in preventive treatment for COVID-19. He said it has been clearly advised that HCQ should be taken with food, not on empty stomach. He added the ICMR also emphasized that one ECG should be done during the treatment. He said it expanded the use of HCQ to frontline workers also, considering the potential benefits.
Health Ministry has reiterated its appeal to the people to follow hand hygiene and social distancing norms to contain the spread of COVID-19 infection. In a series of tweets, the ministry has stressed that as a part of the new normal, people should always follow social distancing norms and wash their hands with soap and water or use alcohol-based hand sanitizer. The ministry said spitting in public is a punishable offence and it increases the risk of spread of the coronavirus. A report.
Health Ministry has urged people to wear face covers to protect themselves and break the chain of corona outbreak. It has also asked people to share authentic information and encourage people if they develop symptoms to get tested. Stigma can discourage people from seeking immediate help and contribute to more severe health problems. Therefore, it is important to break the stigma. Maintaining 2 gaj ki duri is important to ensure everyone's security. People should avoid touching their hands, nose and mouth. They should also refrain from consuming smokeless tobacco products and spitting, as it will not only improve the level of basic hygiene but will also prevent the spread of coronavirus. If anyone develops symptoms like fever, cough and difficulty in breathing, they must immediately call the All India helpline number 1075. Suparna Sekhya, AIR News, Delhi.
In a series Experts Speak on All India Radio, we bring you the views of leading medical experts on COVID-19. Talking to AIR News, Dr. B.N. Gangadhar of the National Institute of Mental Health and Neurosciences, Bangalore, advised the people to do exercise and practice yoga to make themselves free from anxiety and stress.
You can do the exercises together with your family members. You can do the yogasanas or meditation. You can actually do bhajans together. There are so many helplines each of the governments are running. In case you still want to get some help about any of your concerns, the helplines are already available. Depend on these things rather than on social media. If you follow all these things, you'll be able to use this period very, very productively for yourself with the least concern or anxiety for yourself and use this opportunity to help the country.
In this difficult time of COVID-19 pandemic, it has been reported in certain places that corona warriors and corona patients are facing stigma due to fear about coronavirus. Dr. Neeraj Nishchal from AIIMS Delhi says any such feeling of stigma is not based on scientific evidence.
It has been seen that those who have or may have COVID-19 are being shamed publicly. When this disease does not discriminate, then why should we? Most of COVID-19 disease patients will get cured and return safely to their homes within 2 weeks. Let's fight the disease and not the disease. As a member of civilized society, it's our responsibility to help fellow citizens in their hour. So stop stigmatizing and start empathizing.
Indian cricketing legend Sunil Gavaskar appealed to the people to follow all government directions during the lockdown period.
Hi, Namaskar. I'm Sunil Gavaskar and I'm here to request to observe a few things. Please maintain personal hygiene. Please avoid gathering in places because that is where the virus can spread and you might also catch it unknown to you. Please avoid unnecessary travel. And if you feel sick, then get yourself tested. And if you can't get yourself tested, at least observe self-quarantine. The government is doing all it can to make sure that it doesn't spread. But it needs all your help to do so. So let's all do what we can to try and avoid the spread of this pandemic.
Health Minister Dr. Harshwardhan has said therapeutics, diagnostics and vaccine for the whole world is the only way out of the present pandemic. In a series of tweets, he said, a global pool of resources has to be built to pay for the risk, research, manufacturing and distribution with the condition that rewards must be available to everyone. He called upon Gates Foundation to enhance their role and use innovative methods to improve healthcare. The minister was responding to Gates Foundation's tweets in which it congratulated Dr. Harshwardhan on being elected as the chairman of the WHO Executive Board. The minister said his motto is to ensure health for those without wealth.
Arogya Setu, India's COVID-19 contact tracing, syndromic mapping and self-assessment mobile app is now open source. Announcing it yesterday in New Delhi, Niti Aayog CEO Amitabh Kant said transparency, privacy and security have been the core design principles of Arogya Setu since its inception. He added opening of the source code up to the developer community signifies Government of India's continuing commitment to this principle. Mr. Kant said today the scale and size of Arogya Setu is 115 million and it cuts across every smartphone and IVRS in 12 languages. He said in just 41 days the mobile app crossed 100 million downloads.
Open sourcing an app's code means the government will publish it on a public code repository. With the release of the source code in the public domain, government is looking to expand collaboration and to leverage the expertise of top technical brains and also to collectively build a robust and secure technology solution to help support the work of frontline health workers in fighting this pandemic together. On 2nd April, government launched Arogya Setu mobile app for helping augment the efforts of limiting the spread of COVID-19 with an objective of enabling Bluetooth-based contact tracing, mapping the likely hotspots, and dissemination of relevant information. The app has helped identify about 5 lakh Bluetooth contacts. Those who are identified as Bluetooth contacts of COVID-19 positive cases or are classified as needing assistance based on their self-assessment are contacted by National Health Authority. So far, the platform has reached out to more than 9 lakh users and helped advise them for quarantine, caution or testing. Anupam Mishra, AI News, Delhi.
Over 30,000 people have returned to India on 158 flights from different countries under Vande Bharat mission till Monday. In a tweet, Civil Aviation Minister Hardeep Singh Puri said more than 10,000 people have flown out of India on 164 flights. He said another 49,000 people will be able to fly till mid-June 2020 under the mission.
The centre has asked the states to ensure refund of 7 days extra charges taken by the hotels for quarantine from the Indians coming back from abroad. This comes in the backdrop of Ministry of Health and Family Affairs revising the guidelines for Indians returning to stay in hotel quarantine for 7 days and remaining 7 days in home isolation. Such people had booked the hotels in advance for 14 days. The direction to the state chief secretaries was issued by the Union Home Secretary, Ajay Bhalla, amidst reports that some of the hotels are refusing to refund the remaining 7 days advance payment. Chief secretaries have been asked to direct hotels to charge only for 7 days and refund balance. A total of 3,274 Shramik special trains have been operationalized from various states across the country till Monday. More than 44 lakh passengers have reached their home states by these trains. IRCTC distributed more than 74 lakh free meals and more than 1 crore water bottles to travelling migrants. In addition to Shramik specials, Railways plans to start 200 more timetabled trains on 1st of next month. Trains running today are not facing any congestion.
A senior railway official said that migrants have been sent back on a very large scale to their native places by the railways. Speaking exclusively to All India Radio News, he said that special Shramik trains have been run from various states.
बहुत बड़े स्तर पर ये ऑपरेशन चल रहा है जिसमें कि हम श्रमिक ट्रेनों के माध्यम से लोगों को एक स्थान से दूसरे स्थान तक ले जा रहे हैं और इसमें हमने बहुत बड़े पैमाने पे लोगों को अब तक ले जा चुके हैं। ये ट्रेनें सभी राज्यों से मेनली गुजरात, महाराष्ट्र, राजस्थान, दिल्ली, पंजाब इन सभी राज्यों से चलाई जा रही हैं। 3300 के करीब ये ट्रेन हम चला चुके हैं और करीब 45 लाख पैसेंजर्स को हम एक स्थान से दूसरे स्थान तक ले जा चुके हैं।
Speaking on concession and railway fares, he said,
सभी कंसेशन जो हमारे मेन कैटेगरी के हैं वो सभी कंसेशन जैसे कि पेशेंट्स हैं, दिव्यांगजन हैं, इनको छूट मिलेगी, लेकिन इन 2 कैटेगरी के अलावा जो लोग हैं उनको अभी रिजर्वेशन में कोई छूट नहीं है। जैसे सीनियर सिटीजन हो उनको रिजर्वेशन में छूट नहीं है, लेकिन उनका कोटा निर्धारित है। मतलब ये अगर कोई सीनियर सिटीजन यात्रा करना चाहते हैं तो हम नहीं चाहते हैं कि बहुत बुजुर्ग लोग ट्रेन में चलें आजकल, तो इस हेतु हम डिस्करेज करने के लिए अभी हमने कंसेशन ओपन नहीं किए हैं, लेकिन अगर आकस्मिकता के आधार पर किसी को चलना पड़ता है तो उसके लिए कोटा जरूर रहेगा कि वो लोअर बर्थ उनको प्राप्त हो जाए।
The News Services Division of All India Radio in its live phone-in program, Samvad, today will bring a special program on railways where listeners can ask questions to the experts related to passenger trains on toll-free telephone number 1800-115767. You can also ask questions on telephone number 011-2331-4444 and post queries on a Twitter handle at AIR News Alerts by hashtag AskAIR. This can be heard tonight on the FM Gold channel and edition frequencies from 7:10 p.m. onwards. The News Services Division of All India Radio in its bilingual live phone-in program today will bring you a special discussion program on COVID-19. Listeners can ask questions on the same toll-free telephone numbers. This can be heard tonight on FM Gold channel and additional frequencies from 9:30 p.m. onwards. Both the programs will be available on our website newsonair.com and on our YouTube channel News on AIR Official. You can also follow us on the News on AIR app for updates.
Uttar Pradesh government has completed skill mapping of around 15 lakh migrant workers who have returned from other states during lockdown, and this mapping will help them get work near their places. State government has constituted Migrant Commission, which will ensure employment as well as social security for the migrant workers. Chief Minister Yogi Adityanath has decided that without the permission of state government, no other state will be able to get service of the labourers of Uttar Pradesh. A report.
The Migrant Commission will ensure that only after giving the guarantee of social security, any state will be able to get service of workers and laborers of Uttar Pradesh. Meanwhile, Chief Minister Yogi Adityanath has asked officials to send letter to the other states to provide list of the workers who still wants to come back to Uttar Pradesh, and we will bring back them. He has directed officials to complete the skill mapping of all the workers in next 15 days. Till date, around 15 lakh migrant workers have registered themselves in the first phase of skill mapping. The skills include auto mechanic work, driving, electricity work, tailoring and other work. The state government will also ensure the skill training of laborers in state and will provide a stipend and insurance cover for workers in state. If any worker gets job in another district of a state other than his hometown, then government will also arrange accommodation for him. Sushil Chandra Tiwari, AIR News, Lucknow.
A face-off is witnessed between Maharashtra government and Union Railways Minister Mr. Piyush Goyal after Chief Minister Uddhav Thackeray alleged that railways were not able to provide required number of trains. Responding to Thackeray's comments, Mr. Goyal in a series of tweets asked the Maharashtra government to furnish the list of passengers and the number of trains the state government wants. In a tweet, Mr. Goyal said that the railways had planned 145 trains for Tuesday, but only 13 trains could be run till 3 p.m. due to lack of passengers. On request of Maharashtra government, he said railways arranged 145 Shramik special trains. He said these trains were ready since morning and 50 trains were to leave till 3 p.m., but only 13 trains started due to lack of passengers.
You are listening to the morning news on All India Radio. A reminder of the headlines before we move on. India performs much better than the world nations in terms of infections and mortality rate due to COVID-19. Health Ministry reiterates its appeal to people to maintain hand hygiene and physical distancing to contain the spread of infection. Hotel quarantine requirement for Indians returning from abroad reduced to 7 days from 14 days. Uttar Pradesh government completes skill mapping of 15 lakh migrant workers. Migrant Commission to ensure employment to them. Second Squadron of indigenously developed light combat aircraft Tejas operationalizes at Sulur base in Tamil Nadu today, and incessant rain disrupts life in several northeastern states. For quick news updates around the clock, follow us on Twitter handle @AIR News Alerts.
The number of COVID-19 patients in Maharashtra is now doubling over a period of 14 days, unlike every 3 days earlier, and the death rate has been brought down to 3.25% from 7.6% in April. This was informed by Chief Secretary Ajoy Mehta. More from our Mumbai correspondent.
75,000 beds have been kept ready in Mumbai, which has emerged as the hotspot of the disease, and Chase the Virus mission is being implemented for contact tracing in country's financial capital. He said at present 72 laboratories are operational in state and added that 27 new laboratories will be operational soon. He said there are 16,000 surveillance squads in the state and 66 lakh people have been surveyed so far. Meanwhile, Principal Secretary of Health Department Pradeep Vyas said 2.70 lakh isolation beds have been made available for patients. He said 20% of the patients in the state need oxygen, while only 10% need intensive care units. Brihan Mumbai Municipal Commissioner Iqbal Singh Chahal informed that a dashboard is being prepared where the availability of beds in Mumbai will be uploaded every half an hour. Sonali Ghadar Patil, Mumbai.
In Gujarat, a committee of independent doctors took stock of the facilities at Ahmedabad Civil Hospital and submitted its report to the High Court. Following the directions from the Gujarat High Court, the state government had set up an independent committee of 4 doctors to probe the condition of Ahmedabad Civil Hospital, where over 400 deaths were reported due to COVID-19. More from our correspondent.
The Minister of State for Homes, Pradeep Singh Jadeja, said the committee members visited Ahmedabad Civil Hospital and reviewed the facilities for the patients as well as resident doctors. The Mr. Jadeja said the court was also informed about various facilities at the civil hospital with photographs, CCTV network, monitoring room and hospital management system. The divisional bench of Gujarat High Court also said that the judges would also pay a surprise visit to the Ahmedabad Civil Hospital to inspect the quality of care for COVID-19 patients and facilities for medical and paramedical staff. Aparna Khun, AR News, Ahmedabad.
In Rajasthan, with 236 persons testing positive in the state yesterday, the total number of COVID-infected persons has gone up to 7,536. 170 people have died due to corona infection across the state. The number of active cases in the state has gone up to 3,090.
Out of the total active COVID-19 cases in the state, more than 65% patients are migrants returned from other states. 2,011 migrants have tested positive for COVID-19 in the state so far. The state government has said that 21,000 people have been kept in institutional quarantine centers. Meanwhile, the Deputy Chief Minister Sachin Pilot told that 40 lakh persons are getting jobs under MG Narega scheme in Rajasthan, which is the highest in the last 10 years. Jitendra Dwivedi, AIR News, Jaipur.
Farmers in Himachal Pradesh have taken the COVID-19 pandemic as an opportunity. They have come forward to promote natural farming in the state by connecting with the fields and gardens in this corona period. Our correspondent reports that Agriculture Department officials are using digital technology to solve problems faced by farmers in this period of crisis.
These farmers have also taken steps towards making the state a natural farming state by adding thousands of new farmers with them. In order to provide technical knowledge directly to farmers at their place, social media is being used by the officials of the Agriculture Department. For this, WhatsApp groups have been formed at block, district and state levels. Agricultural officials are reaching fields digitally through video calling to solve farmers' problems and are also advising them on natural farming. So far, 94 WhatsApp groups have been formed across the state at various levels and about 5,676 farmers have been linked to it. Apart from this, 3 officers have also been deputed at each block level, whereas project director along with subject matter specialist and deputy project director have been directed to remain in constant touch with farmers during the lockdown period. Sanjeev Sundariyal, AIR News, Shimla.
In the Union Territory of Jammu and Kashmir, the annual Keeravani Mela, scheduled on the 30th of May this year in Tulmulla village of Ganderbal, has been cancelled by the Dharmarth Trust of Jammu and Kashmir because of outbreak of coronavirus pandemic. To know more, let's listen to a Srinagar correspondent.
Jammu Kashmir Dharma Trust has cancelled the annual Keeravani Mela scheduled for 30th May this year at Tulmulla in Ganderbal district of Kashmir Valley. The decision has been made in view of the prevailing unprecedented circumstances following the outbreak of coronavirus pandemic. However, the holy rituals and arti of the deity will be conducted as per tradition, which will be shared with the devotees via social media. It is worthwhile to mention here that the annual Keeravani Mela at Tulmulla Ganderbal, which falls on the auspicious day of Jyeshta Ashtami, witnesses lakhs of Hindu pilgrims from across the country, largely from Kashmiri Pandit community, who throng the famous Ragna Devi temple, popularly known as Keeravani, to seek the blessings of the goddess. Keeravani is one of the biggest religious functions of Kashmiri Pandit community. This is Sunil Kohl for AR News from Srinagar.
On the third day of the resumption of domestic air travel today, Chennai Airport is scheduled to witness 21 takeoffs and an equal number of landings. Yesterday, 41 flights were handled by the airport by following the safety protocols. The state has witnessed 642 new COVID-19 cases yesterday, taking the total infected cases to 17,728. More from a correspondent.
In yet another boost to the resumption of full-scale livelihood activities, the Tamil Nadu government has curtailed the fishing ban period for mechanized boats from the usual 61 days to 47 days this year. In the East Coast, the fishermen are now allowed to set sail for fishing from the 1st of next month, as against the originally planned ban till June 14th. In the West Coast, they can commence fishing operation from the 1st of August. The move is on the premise that even before the official commencement of the ban, fishermen were off the seas due to the lockdown. The centre has permitted reducing the ban period in the country's exclusive economic zone, as said by the State Fisheries Department. However, in Rameshwaram, the fishermen are said to have decided to set sail after the 15th of next month, as the supporting staff who have gone to their native places have to come back. Jai Singh, AR News, Chennai.
A&N Island is going to connect with the mainland again through sea route as well after resumption of flight services. Yesterday, MV Nankari left for Chennai with stranded passengers on board. The ship is expected to reach Chennai on 29th of May. The Indian Air Force today operationalizes its number 18 Flying Bullet Squadron with a light combat aircraft LCA Tejas at its Sulur base near Coimbatore. It will be launched by the Chief of the Air Staff, Air Chief Marshal R.K.S. Bhadoria. The indigenously developed light fighter aircraft is certified with the full operational clearance standard. The Flying Bullets will be the second Indian Air Force squadron to operate with a modern multi-role fighter aircraft. The first squadron with the LCA Tejas, known as the number 45 Flying Daggers, is also headquartered at the same base.
The Army Commanders Conference, an apex-level biannual event which was scheduled for April 2020 and postponed due to COVID-19 pandemic, will now be organized in two phases. The first phase of the conference will commence from today, which will continue till the 29th of this month. The second phase will be held in the last week of June 2020. The apex-level leadership of the Indian Army will brainstorm on current emerging security and administrative challenges and chart the future course for Indian Army. Home Ministry has dismissed media reports that it has permitted all states to open schools. The Ministry clarified that no such decision has been taken by it. It said all educational institutions are still prohibited to open throughout the country.
In Arunachal Pradesh, incessant heavy rain in the past few days has crippled life at many places across the state. Flash flood and landslides triggered by rain have snapped road communications to many interior places.
In Dibang Valley district, 3 persons of a family lost their life due to landslide. Chief Minister Pema Khandu has expressed deep shock and sorrow over the incident and has announced immediate ex gratia of rupees 4 lakhs each to next of kin of the deceased persons. In East Siang district, administration has issued advisory not to take the Pasigat rowing route via Siseri Bridge after continuous rain-triggered rock slides have been reported at many points of the road. State government has issued directives to all the deputy commissioners and disaster management department to monitor the situation on a regular basis. Rakesh Dole, Air News, Itanagar.
In Meghalaya, incessant rain and cyclonic storm has wreaked havoc in parts of the state with over 1,493 population and 21 villages affected in the last 24 hours. Following Cyclone Ompoon, the state witnessed heavy showers, cyclonic storm and hailstorm in various districts, triggering landslides, floods and washing off of roads and bridges. Meghalaya Revenue and Disaster Management Minister Kirman Sheila informed that 5 districts have been affected. The India Meteorological Department has predicted thunderstorms and gusty wind along with very heavy rains at isolated places at several districts in Assam in the next 2 to 3 days. Around 2 lakh people are affected in 7 districts in the state due to floods. Nearly 9,000 people are taking shelter at relief camps at Gwalpara and Tinsukia districts. Floodwater also damaged standing crops at various districts and also disrupted road communications.
In Assam, the National Disaster Response Force teams have been stationed at 9 places to engage in flood relief and rescue works.
Now let's take a look at the weather forecast for today. There will be a heat wave in New Delhi today. The national capital will see a minimum temperature of 28 and maximum of 46. Mumbai will see a partly cloudy sky. The minimum temperature in the city will be 28, while maximum temperature will remain around 35. In the south, Chennai will see a partly cloudy sky. The temperature will hover between 30 and 36. Kolkata will see a generally cloudy sky with possibility of development of thunder or lightning. In Gilgit, the temperature will hover between 13 and 36. It will see a clear sky. In Muzaffarabad, there will be mainly clear sky, becoming partly cloudy towards afternoon or evening. The minimum temperature will be 19, maximum 39.
And now an overview of today's newspapers. The top news in most dailies today refers to the tension with China along the line of actual control LAC in Ladakh. PM reviews LAC standoff with NSA, CDS and 3 service chiefs, headlines The Hindu. India firm owns step back from areas where Chinese troops have intruded is the headline in the Times of India. And finally, with Churu in Rajasthan hitting 50 degrees Celsius, North India was the globe's hottest region on Tuesday, reports the Times of India.
Prime Minister Narendra Modi has paid tributes to India's first Prime Minister Pandit Jawaharlal Nehru on his death anniversary today. And now before we end the bulletin, the headlines once again. India performs much better than world nations in terms of infections and mortality rate due to COVID-19. Health Ministry reiterates its appeal to people to maintain hand hygiene and physical distancing to contain the spread of infection. Hotel quarantine requirement for Indians returning from abroad reduced to 7 days from 14 days. Uttar Pradesh government completes skill mapping of 15 lakh migrant workers. Migrant Commission to ensure employment to them. Second squadron of indigenously developed light combat aircraft Tejas operationalizes at Sulur base in Tamil Nadu today. Incessant rain disrupts life in several northeastern states. And with that, we end the morning news. Have a nice day.